One reason we all love Dear Evan Hansen is the way that the show accurately represents mental illness. Most media has a hard time doing this, so finding a story and characters that accurately portray the symptoms and feelings of anxiety and depression feels like a beacon of light amongst the darkness of stereotypes. In this video, I want to talk a little bit more about the mental illness represented in Dear Evan Hansen and their symptoms and treatments. Also, if you couldn't guess already, this video contains spoilers about pretty much the whole show. Disclaimer, I am not a psychologist or doctor, so please do not use this video for self-diagnosis. All of the mental disorders discussed in this video should be diagnosed by a doctor. If you find yourself experiencing the symptoms mentioned in this video, please speak to a medical professional for an actual diagnosis. In a similar thread, because this video talks about anxiety and depression, it may be triggering for some people. Also, I did do all the research to find the information used in this video, and the sources are listed in the description. I would also like to note that this video is based on my opinions of the characters in the show, and all these are just possible disorders that I think they might have. Alright, let's begin. Let's start with anxiety disorders. Evan's anxiety really is the driving force of the show, and while there are many anxiety disorders, I want to focus specifically on generalized anxiety disorder and social anxiety disorder. Generalized anxiety disorder is an intense, overwhelming anxiety about seemingly normal things. People with GAD know that their worry is irrational. The disorder usually develops between childhood and middle age. People with GAD can have other mental disorders as well as anxiety, such as depression. Doctors often diagnose GAD when a person has had 6 months or more of chronic worry. There are several potential factors that can cause this anxiety. It can be caused by genetics or behavioral developmental factors, or sometimes a combination of both. Researchers believe that the amygdala, basically the intelligence agency of the brain that receives information and sends out reactors, is responsible for anxiety. This part of the brain could be the cause of other mental disorders such as depression and bipolar disorder as well. Basically, the amygdala is problematic. Social anxiety, the other anxiety disorder in the show. Evan definitely has social anxiety. Social anxiety is the third largest psychological disorder in the U.S., and it affects 15 million Americans. That's roughly 5% of the U.S. population and more than the population of the whole state of Illinois. People with social anxiety fear interacting or being watched by other people. Just like with GAD, people know that their fears are irrational, but the knowledge that it's irrational doesn't make waiting for the pizza delivery guy to count the change any less nerve-wracking. Having social anxiety makes having interpersonal relationships really hard for obvious reasons. People with social anxiety often want friends and relationships, they just struggle with having and maintaining them because of their anxiety. It's hard to go out and make friends or keep friends if interacting with people gives you anxiety. Sometimes social anxiety is called social phobia, but that name isn't accurate because a phobia is a more specific fear. Plus, the word phobia has negative connotations and generally gives the wrong impression of the feelings that people with social anxiety have. There are several treatments for anxiety disorders, the first and most obvious being therapy, like Evan seeing Dr. Sherman and being told to write the letters to himself. Therapy often includes homework like that. In fact, cognitive behavioral therapy uses activities like that to retrain patients' brains to help them overcome some of their anxiety. There's also, of course, medication, which is often used as well as therapy. Anxiolytics are one category of drugs that are used to counter anxiety. They are designed to quiet the central nervous system. Some of these include Xanax, Librium, Valium, Atarax, and Buspar. They can be very addictive though, and like all drugs, they each come with their own varieties of side effects. Alright, before we get into depression and other mental disorders that Connor might have, I would like to take a brief moment to talk about Alana and high-functioning anxiety. Alana seems to be a standard case of high-functioning anxiety. She mentions knowing what it feels like to be forgotten. She also shows almost all the typical signs. The overachiever, someone who drowns themselves in work or seems like a high-energy extrovert with lots of not close friends. High-functioning anxiety is fueled by pressure and fear of failure. Though it may seem like the person is successful in life, they really may be struggling. There are physical symptoms of high-functioning anxiety, just as there are with other anxiety disorders. Symptoms include headaches, a weak immune system, muscle aches, nervous tics, and more. It is often hard for people with high-functioning anxiety to talk about their anxiety because a lot of times people don't believe them. It's important to recognize that high-functioning anxiety exists and that we need to be more aware of it. Depression. The feelings of endless sadness and hopelessness. Both Evan and Connor have at least some form of depression. Evan specifically displays the symptoms of hopelessness, pessimism, and thoughts about death or suicide. It is common that people with anxiety have depression because anxiety can oftentimes trigger depression. Connor had depression just judging by his actions in the show. Depression is one of the most common mental disorders, and it can happen at any age, and oftentimes depression is expressed as aggression in young adults. There are several factors that could lead to depression. The first is genetics. People are more likely to have depression if another member of their family has it. Major life changes and trauma can also lead to depression, and in some cases, people are just more prone to depression because of their personalities. There are quite a variety of treatments for depression. There's obviously psychotherapy and medications. Antidepressants include Celexa, Prozac, Cymbalta, Anafranil, and more. Oftentimes, antidepressants are also used to treat anxiety. However, there are some severe side effects with antidepressants, and a lot of times they increase suicide risks, especially in young adults. They can be extremely dangerous to people who were already suicidal. Besides therapy and medication, there are also other treatments for depression. Surprisingly enough, sometimes shock therapy is used. Now, before you jump to conclusions, let me explain. This is very different from the stuff we see in movies where a patient is strapped to a table screaming and being tortured. Modern-day shock therapy is consensual and painless. Patients are put under with anesthetic and given muscle relaxants, and then electrical shocks are administered to their brain. The theory is that electrical stimulation essentially jumpstarts the neurons in their brain, which is believed to help a depressed brain function more normally. The technically correct term for this therapy is electroconvulsive therapy. Electroconvulsive therapy, as well as other types of stimulant therapies like repetitive transcranial magnetic stimulation and vagus nerve stimulation, are only used to treat severe depression that hasn't been successfully treated in any other way. Thankfully, though, depression is a really treatable disorder, and 80 to 90% of the people respond well to treatment. Okay, now something a little bit more specific to Connor. I want to talk about borderline personality disorder. This is less common than anxiety or depression, but it is still one of the most common disorders and one of the most under- and misdiagnosed disorders. Connor, in the brief time we see him on stage, displays almost all the symptoms of borderline personality disorder. Things like intense, unstable relationships, impulsive and dangerous behaviors such as drug or substance abuse, chronic emptiness, inappropriate anger, paranoid thoughts, and, a very relevant symptom, suicidal behavior and self-harm. The risk factors for having borderline personality disorder are much the same as other mental disorders, genetic and environmental factors. However, borderline personality disorder is believed to be at least partially caused by the lack of activity in the prefrontal cortex, which is the center for impulse control in the brain. It is thought that borderline personality disorder starts developing in childhood and is caused by growing up around emotionally unstable relationships or dealing with abandonment or abuse. There really aren't very many treatments for borderline personality disorder since so little is known about it. The main treatment is therapy. Dialect behavioral therapy focuses on teaching patients how to control their emotions and impulses. Schema-focused therapy works toward rebuilding self-image, and there are a vast number of other specialized therapies. There are also, of course, therapies for families that teach them how to learn to live with other family members with borderline personality disorder. Sometimes psychologists will prescribe medications to help with depression and anxiety that sometimes occurs along with borderline personality disorder. It can be very dangerous, though, because people with borderline personality disorder are already often a suicide risk. But borderline personality disorder is not completely untreatable, and cognitive behavioral therapy can work to help people with BPD. I hope that if you don't have a mental disorder, this video helped you a little bit better understand the show and the people and the world around you. If you do have a mental disorder, then I hope that this video just reaffirms the point that the show makes, that you'll reach up and you'll rise again, and that you are heard and you will be found. Mental illness is treatable, and more people than we realize have it. You are not alone. If you ever feel suicidal, please reach out to someone. I've linked the suicide hotlines and other places you can call if you need help in the description. Please know that you are loved and important. That's all for this video. I love you all, you're all glorious, and I'll see you next time. Bye!